Bismillahirrahmanirrahim. I start the CME with the name of God Almighty Allah, who is very beneficial, merciful, and very kind. And CME update by Mother and Child Survival Group of Pakistan, me, Dr. Tariq, Ops Gynae Family Emergency Specialist, internist, Gulf KSA, presently a district gynecologist. CME update I will be a part 2 of the artificial reproductive techniques, uh, which I already mentioned, this IVF and ICSI and intrauterine insemination. I'll be discussing the other techniques of ART. ART, as I have told already, these are all the reproductive techniques in which the sperms and eggs are handled with the aim of achieving the pregnancy. This includes IVF, in vitro fertilization, ICSI, intracytoplasmic sperm injection. Third is peri-implantic genetic diagnosis. Fourth is PGS egg donation, and then the donor insemination and intrauterine insemination, and then the surrogacy. Whether it is IVF surrogacy or natural surrogacy, we'll touch a little bit of it. As compared to IVF, already I have told in my first instance lecture that it has to be handled in a couple who is subfertile and who has been trying for the last many years for having, and especially those which have an evolution with endometriosis, moderate to severe, unexplained infertility, and those having with the intramural fibroids and others. So these, in which these there are other indication as well. Most important is the unexplained infertility and the male factor, tubal disease, and endometriosis. This is a already we have discussed that what are the parameters, what are the criterias, and how the age matters, the success of previous pregnancy, history of previous pregnancy matters, history of intramural fibroids, and this all already also matters. And the IVF protocol is that this is done with the antagonist, the agonist, GnRH analogs and antagonists. They are used in order to for down regulation of the pituitary, and then then ovarian stimulation. Ovarian stimulation is done by the FSH and human menopausal gonadotropin, and when it has reached, the follicle has reached the maturity, and then it is done with the HCG and then that after 36 hours the eggs is retrieved and cultured with the sperm, and then it is transferred on the second to third day, or the fifth day. At the fifth day is the blastocyst, and third day is the cleavage stage. In which then later on it is to be considered that no more two embryos are transferred in chances and having a chance of multiple pregnancies, and then luteal support is provided and pregnancy test is 2 weeks later. And then third one is the peri-implantation genetic diagnosis. This is the condition in which the genetic risk in the recurring couples are minimized, are reduced by peri-implantation diagnosis, because though the couples are fertile, but they are given but the single embryo, but the embryo biopsy is taken, and single cell is then checked with the and then it is the normal cells are returned back to the in the returned back uh, to the IVF mother. Then comes in this fish and other techniques, they are utilized for the interpretations of genetic disorders. Then comes the intrauterine insemination. This is common in the mild endometriosis, unexplained infertility, and coital difficulties, and same-sex couple. In this the intrauterine insemination is done, and it is simply transferred to the uterus through the transvaginal through the catheter. And there's no strict criteria, but at least the sperm motility should be more than 10 million count. Rest there are nothing else. Sometimes there, especially in the endometriosis and in the mild male factor, in the mild endometriosis, ovulatory protocols are needed for ovarian stimulation with or without and with beta HCG administration. Then comes the PGS diagnosis, PGS egg donation, in which this is used in those women who are irreversibly sterile, like those with genetic disorders like gonadal dysgenesis, and with prematurity, and with secondary to surgery and chemotherapy, and also with the menopausal, and also with the age greater than 45 years, and also with those women who have failed IVF techniques. So it is done with this donor who are unable to, who are irreversibly sterile. Then comes the donor insemination. Donor insemination is done in the those one where there is difficult to retrieve a male sperms surgically, or faulty, and there is azoospermia, and then there is also then also that fellow having genetic disorders like Huntington chorea, or can transmit the HIV, or the women who do not have any partners, male partner. So it is done, and in this also ovarian stimulation protocol with beta HCG may or may not be applied. Then following this, because all these artificial techniques are covered by the HIFA rules, which says that patient must be counseled, couples must be counseled, and legal advice be taken, and had to follow the protocols of the HIFA, which says that there should not be any disease, medical, surgical, or physical, or psychiatric disease to any of these donors. And then they must be counseled, and they must have infective screen, and they follow the rules and regulation with the informed consents, and then they all follow a protocol and the guidelines given by the HIFA. And then comes the they have those children after in 2005 the rule has been made that after attaining the age of 18, then they can find their donor, contact HIFA for the donor, and also to obtaining donors from outside the in UK, they have to follow these strict guidelines as per UK rules, donor eggs and sperms. Then comes the surrogacy. IVF surrogacy is that the couple has to provide both the male gametes to the surrogate mother. They has to provide, and then it is transferred to the surrogate mother. This is the 0.01 followed in United Kingdom, and also this involves also and then the natural one are the one in which the male partner provides the sperm to the surrogate mothers. So these are one of the few reproductive artificial techniques which I mentioned, again revising it: in vitro fertilization, ICSI, intracytoplasmic sperm injection, which has solved a greater problem of the male defect sperms, which are difficult to retrieve or through ejaculation, and with the low motility, and they have increased the IVF rate success very much. And also PGS, pre-implantation genetic diagnosis, intrauterine insemination, and then the egg donation, and then the donor insemination, and then the surrogacy. With that, we come to an end, and we come with another review soon. And thank you for very much patience listening, and salam alaikum, and best wishes and regards. And we must not forget our glorious past. दो नीम इनकी ठोकर से सहरा व दरिया, सिमट कर पहाड़ इनकी हैबत से राई. And we have take away messages: pray, praise, trust, love, talk, worship Allah, and follow Rasul sallallahu alaihi wasallam, our health and survival. Allahumma ajirna minan nar, save us from the fire. Allah, save us from the fire of Jahannam. Allahumma zikrak, shukrak, wa husn ibadatak. And also hasbunallahi wa ni'mal wakeel, wa ni'mal mawla, wa ni'mal nasir, wa kafa billahi waliya, wa kafa billahi nasira. Best of luck, best wishes. We'll see you in another review. Wama alayna illa al balagh.